we have a fairly informational session set up for you. My name is Mike Riggin. I work at Pacific Northwest University, and as you can see, we've got a lot of representatives from a lot of the DO schools here. What we're going to do today is we're going to turn the time over to Amanda and Teresa from A.T. Still University, who have put together I'm going to let them introduce it, but they put together a kind of an informational PowerPoint for you guys on osteopathic medicine, the schools, all that kind of stuff. When we're done with that, we're going to do a Q&A. We're just going to open it to you guys for questions. Okay, that's where you're going to get most of our information from. And then at the end, we'll split up, and that'll be the time for you to speak to the individual schools individually. Okay. I'm going to apologize to you up front. We are going to be doing this exact thing tonight at Brigham Young. And so we're going to have to skedaddle out of here when we're finished, because we're going to try and miss all the traffic. So I just want you to know it's going to be a volume-packed time for us. So, okay? So I'll turn the time over to you guys.
Do we need to turn down the lights over here? Can you guys see that well enough? I don't know. Yeah, because there's windows up here, so I don't know that we can dim it a whole lot. We're going to have light coming in, so. So my name is Amanda Clark. I'm the Assistant Director of Residential Admissions with A.T. Still University. Like Mike said, this is a presentation that we use not a ton, but for some groups, you just kind of need to start out with the beginning and explain what osteopathic medicine is. It's something I think all of us are talking about at our tables or when we meet with groups, just giving that brief history. So I just have a few slides to go over with you guys before we kind of get started with the Q&A panel. So ignore our banner on the bottom, because I can't remove that from these slides, because this is kind of the history of how all of us kind of got our start. So A.T. Still University started, Dr. Andrew Taylor Still was the founder of osteopathic medicine. That's how our school gets our name. So you'll notice that he was a trained MD. He has MD after his name. He served during the Civil War, was a surgeon on soldiers, and really just didn't agree with all of the practices that were going on at that time. A lot, if not all of the medications were laced with cocaine at the time, so a lot of soldiers were having these adverse effects to whatever prescriptions they were giving them. And they also used methods like leeching and bloodletting. And so Dr. Still really kind of walked away from the war, just kind of having a bad taste in his mouth, feeling like there had to be a better way. Well, he returned home from war to find that 3 of his 6 children had died of meningitis. And later he lost his first wife as well. So that really was the catalyst to get him started on really defining and figuring out what this better way is. And so on our campus, we have a lot of old pictures of Dr. Still, and some of them are in this presentation, but he would actually walk around with this big black bag with a skeleton in it. And so he oftentimes would just sit and study the skeletal system and how everything fit together. And so we'll talk about some of the tenets of osteopathic medicine and kind of how that came about as a result. But in 1892, Dr. Still founded the American School of Osteopathy, which was our original school name, and now it's called the Kirksville College of Osteopathic Medicine. So we believe that by correcting the body's problem with the body's structure, that you can actually get the body into a standing that is homeostasis with that body. And so when your body is in this state of homeostasis, it can actually heal itself for the most part, if not completely. And so he really focused on getting that body back into homeostasis so that health can be improved. He promoted the idea of preventative medicine and the philosophy that doctors have to go out and treat their patients as a whole, as opposed to just being concerned with the one symptom that they may come in complaining of that day. So he really focused on the body, mind, and spirit. So these are the 4 tenets of osteopathic medicine. I'm just going to read them to you because I don't have them memorized word for word. But the first tenet, the body is a unit. The person is a unit of body, mind, and spirit. Number 2, the body is capable of self-regulation, self-healing, and health maintenance. So again, when the body is in homeostasis, it can do a lot of the healing on its own. Structure and function are reciprocally interrelated. Rational treatment is based upon an understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function. So osteopathic medicine really focuses not only on whole person health care, and that the body is innate, is a unit, but but that the body can actually heal itself. And so there's a big emphasis in preventative medicine. A lot of DOs go into primary care, but that is one of the myths. You don't have to go into primary care. I think in any program that you're studying at any school that you would go to of osteopathic medicine, that you're going to learn a lot about preventative medicine and primary care, but you're also going to be very well suited to go out into a specialty if you choose. So what is a DO? A doctor of osteopathic medicine is a fully licensed physician. They have the ability, again, this is a myth that we are always trying to dispel, have the ability to prescribe medications and practice at all specialties. They focus on preventative medicine. They learn to use their hands to diagnose and treat patients using OMM, which is osteopathic manipulative medicine, or OMT, osteopathic manipulative treatment. They're one and the same. And a DO is trained to consider the health of the whole person, like I've mentioned. What is OMT? So OMT, osteopathic manipulative treatment, also known as OMM, osteopathic manipulative medicine. OMM, OMT are pretty interchangeable. Involves using the hands to diagnose, treat, and prevent illness or injury. Using OMT, a DO can move muscles and joints using techniques including stretching, gentle pressure, and resistance. So a lot of people confuse, until they really know what OMM is, they confuse it and think that it's very similar to chiropractic, sort of the same as chiropractic. And while they are somewhat similar, OMM does not focus on the skeletal system alone, and that's what chiropractic does. Chiropractic focuses on the skeletal system alone. OMM focuses on the musculoskeletal system. Okay, you can use OMM to crack a neck or crack a back. You can use OMM to release muscle tension. You can use OMM to drain your sinuses. You can use OMM to promote drainage of the lymphatic system as well. Using OMM, so using your hands to treat and diagnose your patients, just promote healing. So OMM is actually used after some surgeries, just to kind of promote healing within that body area of where the surgery might have been performed. OMM or OMT is an extra tool that DOs have to use in their practices. DO and MD similarities, so they're actually very much more similar than most people think. They do have some differences, but both DO and MD students will go through 4 years of undergraduate education. They'll have a bachelor's degree. They'll go through 4 years of basic medical school education. They both set for national and state licensure exams. They have the ability to specialize in any area. They don't have to go into primary care. They practice together in AOA and AMA accredited hospitals and clinics, so oftentimes they are working together with patients, and they both undergo continuing medical education. So a DO actually learns everything that an MD learns, and then some. So what makes a DO different? So again, the osteopathic manipulative medicine. They see the body as an integrated whole. They know that everything within the body is interrelated, and so even though someone's coming in with this one complaint, a DO recognizes that, okay, that's what their complaint is, but let's try to find out what's actually causing it. Okay, and what else could be affected by this one area or this one complaint that they have. They focus on patient-centered preventative medicine. So again, in any DO program that you go into, you're going to have a huge focus on your patient care skills. A lot of allopathic schools really have a big focus in research, and DO schools are definitely not against research. Research is very important. If you guys have research experience, you should be making sure you put that in your application. But we also want to see students coming in with patient care exposure already at the time of application, because as a DO, patient care and the way you approach your patient and the way you communicate with your patient is a really kind of one of the utmost important things that you can do as a DO. A DO emphasizes the musculoskeletal system. They use structural diagnosis and manipulative treatment to encourage the body's natural tendency towards health. So I talked about how DOs learn everything that MDs learn, and then in addition to that, they go through about 200 extra hours of OMM, as well as a huge focus in anatomy as well. And they also learn using their hands about advanced palpatory skills development in the curriculums. These are some of the general DO admissions requirements. I think, Mike, for your program, you said you guys don't require the lab. for the sciences. And so we can talk about those little differences amongst our programs, but these are the general things that we're looking for that are required. And then along the bottom there are some of the things that a lot of the DO schools look for in applications whenever we are reviewing them. And I think that was my last slide, so I'm not going to click ahead, but I'll leave this up for you guys to look at. And so that's kind of the history of osteopathic medicine and how it came about. So, do you guys have any questions about the history or Dr. Still? All right, I'll turn it back over to Mike and we can get started.
Thank you, Amanda. I appreciate that. You know what? I was remiss. I'm going to start at the beginning here because we have a lot of reps here that maybe you folks have not met. I want to go around the room and just let them introduce themselves.
Should we come down here instead so we're all, so they're
You guys want to come down here? I'll leave it up to
as opposed
them.
to having to turn around?
You got your 10,000 steps in yet? Come on. There you go.
I can see it. I'm ready to start.
2 reps for every student here.
Everyone else is saying?
Yeah, let's just go ahead.
My name is Amanda Clark. I'm with Touro University. We have 2 campuses, the founding program in Kirkland, Missouri, then we also have a DO program at our Mesa, Arizona campus. And then we also have Teresa Hunsaker with our program as well. So.
I'm Brett Moser with Kansas City University, and we have a campus in Kansas City, Missouri. And we also have a campus in Joplin, Missouri, which is in southern Missouri.
I'm Susie Fink. I'm from Western University of Health Sciences. I'm located in Pomona, California, which is Southern California.
I'm Luke. I'm on the Oregon campus. Same thing.
I'm Cindy. I'm from Rocky Vista University with campus in Colorado and Utah.
I am Matt Johnson. I'm with Des Moines University in Des Moines, Iowa.
I am Mandy. I am from Touro University.
So thank you. I should have done that in the beginning. Before we go to Q&A, are there any reps here who want to add anything to the PowerPoint presentation? So I'll add one thing. So at our school, you heard Amanda ask me, because we don't have lab requirement in our school. Please understand that that doesn't excuse you from keeping labs. It's just that we don't have that requirement, but I strongly recommend to every applicant that while you're going in undergrad, grab as many labs as you can because it's just going to prepare you for school. It has nothing to do with the requirement, just do it. It's a good thing. Okay?
I will add something. These are the requirement, but I know for our DO programs, we do have a couple of courses that we suggest. You know, if you can take them during undergrad, it gives you a little bit better foundation. We found that the students that do take these before they get to medical school are happy they did, and the ones that didn't wish they would have. And those would be biochem and anatomy.
Yeah, you're going to need biochem to get through the MCAT, so, so understand that, and micro as well. That's one of the classes that our students, that once they matriculate, wish they would have taken as micro, so, okay. Anyone else? Well, you guys have a job ahead of you because you got five students here, and we got to fill up some time with questions, so guess what? It's Q&A time. For the panel, you can pick a specific school or just throw it out to the panel as a whole. What kinds of questions you guys have? No, that's not the right answer.
I have questions. Mine's a pretty different situation. I have an undergrad in accounting and a master's in business administration. And my undergrad in accounting, I spent most of my time focusing on work. And then my last year, my wife was weekly had triplets. And so she was pregnant during my last year of school, and that had an adverse effect on my GPA. So I graduated my undergraduate with a 3.0, and then my master's was a pass-fail. So being back, my GPA is good now, but I'm wondering how many of you are going to look at this and say, okay, well, his undergraduate was a 3.0, these last 2 years of prerequisites is more along the line of what we expect. Tell me what you guys think about that.
Is it that you're an accounting major, so one child wasn't good enough, you had to go straight to
I had to get the most bang for my buck.
I think you're still in the same pool as other candidates. So everybody has their own story. So you got to stay somewhere in the mix to make it to the interview stage of the game. So wherever your grade point is, if the average is a 3.5 for med schools, give or take 0.3, 3.2 to 3.8, you're in the normal ballpark as long as some other things look strong. I wouldn't stress. If you're dropping below threes, you definitely need some really shining something. Withdrawals are seen by the admissions committee, but it's probably not the first thing in terms of choosing candidates. If the GPA is strong and the MCATs are there, then I think you're okay. But it's hard to explain your story and telling it into the interview stage of the game because you don't want to waste too much personal statement place. You don't want to make excuses when applying. You just want to focus on your strengths.
Anyone else have a thought on that?
I think the biggest thing is when you submit the primary application, the ECOMAS application, they're going to calculate a GPA that factors in all the schooling that you've done. And at least for our program, we focus most heavily on what is your overall science GPA, overall class you've taken, also what's your overall cumulative GPA across all those degrees. And if that is within a competitive range, then that's what matters. So we're not going to particularly look at what, if you had some missteps in undergraduate, if that number that shakes down at the end of it, if it is within a competitive range, it meets the minimums of all these schools, then your application is going to get the full review treatment. It only becomes an issue if when those numbers are calculated, if it throws you out of a competitive range.
And your most recent grades are usually noticed more heavily. So if you had a blip somewhere, people often the freshman, sophomore year is the most common thing where they just didn't get focused. If you have one blip, what you're describing, life happens, it's when multiple dips happen that it really is a scarier thing because you can't have that happen once you're in med school. And so often the most recent 1 or 2 years also is getting a little bit more weight because that's showing who you are now, even if you had something else previous.
Yeah, go ahead.
Well, we are all very non-traditional student friendly too, and so we understand especially non-traditional students are going back to take prerequisites or, they are coming with a family, and so they have a lot of things that they're juggling during their college years. And so again, like having the triplets in your senior year, senior year isn't really a place you want things to dip. So, we advise applicants if there's a red flag, if you have a weaker point of your application, to try to explain it, because our committee understands that. We understand that things happen and we take that into consideration. So I would advise maybe mentioning the birth of triplets in your senior year and that having an effect, and that way you don't just assume like, what happened in that senior year? Because now he's doing better, but that senior year, like why senior year? So, but yeah, I think all of us understand that and have a lot of students coming in. So one other point I wanted to make is that you guys may or may not have noticed, but DO school averages are a little bit under the allopathic school averages, and that's not because we're necessarily easier to get into, it's because we're looking for a different type of student. So we don't necessarily look for students that came through with like a 3.95 or 4.0 and has a 525 on the MCAT. We're looking for students who did well, but also volunteered and shadowed or held jobs and juggled more than one ball at a time, because if you're only focusing on your courses, it's a lot easier to do really well in those courses. In medical school, you're going to have a lot to juggle. So that shows us, how you're probably going to do in our program. So that's why we're looking for a well-rounded applicant. So that's why our averages are a little bit below what you'll see at allopathic schools.
For any of you who might be in this particular situation, there's another option for you, and I think most of us, and I shouldn't speak for everybody, but for a lot of schools offer typically what is referred to as either a bridge program or a linkage program designed to help someone at the master's level beef up their academics. It's not at every school, but it is a common thing today that a lot of students will go back through a master's program designed specifically to help them bridge into a professional school. So that's also an option. I'm not suggesting it's an option for everybody, but it is an option. If you find yourself in a situation that you just can't compete academically. Okay. Anyone else? Okay, next question.
So I got a question. How much emphasis do you guys put on a DO letter of recommendation compared to an MD letter of recommendation?
It's a really good question. Anyone want to start out with that?
I would say a DO letter of recommendation is absolutely preferred, and I think everyone here would probably echo that. But from my own perspective, when I'm reviewing and I only see an MD letter, I know oftentimes a lot of that has to do with accessibility. Maybe there isn't a DO in that community, and we're not going to hold that against you. But if given the opportunity, it is always preferable that you do have that DO letter.
For our school, in our file rating, which is a formula that everybody puts your information through, we actually award you points for a DO letter. We don't take away points for an MD letter. You just don't earn any points for an MD letter outside of the content of that letter. So at our school, it is highly recommended to find a DO. And that's, the advantage of a DO letter is, unless your dad's a DO, you're going to have to go shadow that individual, which forces you to be able to see the differences, albeit minute, between what an MD does on a daily basis and what a DO does on a daily basis. So the truth is, it's a really good thing to do both MD and DO shadow for yourself, just so that you can see it. But I think, do the math. You're talking to DO schools.
Yeah.
We're going to prefer that DO letter. Anyone else have any thoughts on that?
I was going to say, we do not require a DO letter, and honestly for us, it's more about your clinical exposure. So when you get a letter from a physician, it's usually because you have spent a significant amount of time with them. So we are probably more concerned about the quality of that letter, regardless of who it's coming from, versus what the letters are behind that person's name.
Does anybody require one? It's highly recommended, but
I know BCom.
There are DO schools that require, but I think the majority of us don't require. We would just strongly prefer it. Let's go here first.
So is it OMT or ONM? So is it, I heard it's an extra exam then that you take or no?
No, it's an extra skill you learn. It's built into the curriculum. So like at our campus, they take it throughout the curriculum. It's not just one course that you take in one semester and then you move on to the next course.
but for your board exams, it is an extra portion of the test.
Okay, it's extra.
So there's the complex for DOs and MD and DO board exams.
Right.
And relatively speaking, same information, except the DO board exam has a separate piece of the test, which is the hands-on portion.
Is that like a practical test or is that actual just or is it?
At different stages, it's both. I mean, it depends on where you're looking.
Okay.
And so that's questions as they merge residency. Right now, many DO students will take both board exams if they're trying to go maybe to MD residency, so they don't know what specialty they're choosing. And MD students can't take the DO board exams because they haven't taken this class. How does that work? How do residencies weigh that? But as they merge the systems, it's going to be better for everybody involved.
Anyone else have a thought on that? Okay, so we had another question here.
So talking about what you guys think of when you say clinical exposure, that's what you're looking at. I